grocery store, but do you want to do that? Or is it another pill that you might be taking? How about taking upon yourself the responsibility of using the same technology that doctors and physical therapists are using to help to relieve pain? It's called Revive. It's DPL, Deep Penetrating Light. I want to introduce you to a dear friend, Dr. Anna Lobdus. Give me a hug, baby. How are you?
Oh, great to see you. Hi,
as a chiropractor, very seldom does a patient walk in and go, hey, I just came to say hi, I love you. They always come to you because of pain.
Number one thing why anybody walks into a doctor's office because of pain.
This unit is FDA cleared. It is identical to what is used in doctors' offices, such as Dr. Lobdus's. Now it's available at home. This is the second generation from what you brought to us.
This is with a wider coverage, so it's 83% larger than the original one.
16,000 QVC customers have tried it, trusted it, and use it. 16,000. We have less than 1,500 units left, and when they're gone, they are gone. Now, when you turn it on, you're going to see 4 red lights. The others don't look like they're working at all, but they are actually emitting light that is of a wavelength that our eyes don't see.
Don't see, but what it's doing underneath your skin and getting to the source where you're having that problem. This DPL light, FDA medical device, which is so important because it works. So it's a device that you can use in your home. I've used in my office for many, many years. Doctors, hospitals, physical therapists, sports teams. This is that go-to when someone would walk in and say, you know what, I've hurt myself and it's been lingering for a little bit, or my family member, or I have arthritis. Over 50 million Americans suffer with arthritis. This is something that I pulled out of my tool chest, as I call it, and applied it directly on the skin of my patients. And it could be anywhere in their body. I was just treating someone in my house the other day because they were working out and they fell and hurt their neck. I immediately use the DPL light. The wider coverage allows you to have less treatment time, larger area to treat, to allow you to feel better, reduce the spasms, reduce the stiffness, reduce the aches and pains, because the LED light is all about therapy that goes to the source of where the problem is.
Well, medical science has changed dramatically in one generation. Everybody in the 70s and 80s had a heating pad at their disposal. This is more than a heating pad. Instead of just topical warmth, it's penetrating warmth. And by doing so, then your body can help itself.
Absolutely.
And we can actually show some animation of what works and how it works.
The DPL wide coverage light works with your body and it goes to the source where you're experiencing pain. Here we're showing it on the elbow. So gently but effectively goes below the area, goes to where you're feeling the stiffness in your arm or your body, the soreness, the achiness, the pain that doesn't allow you to have movement. It stops you in your tracks from going out and doing the things that you want to do. Simply putting the DPL light directly on the source where you're experiencing pain for 14 minutes, I recommend twice a day. But what's great about the DPL light is it's got a built-in shut-off after 25 minutes. So you can use it hands-free because we give you an exclusive belt here, or you can hold it in, wherever you want to put it, where you're experiencing pain. But this is something that I used in my own practice for many, many years to help patients. The difference is you don't have to come see me in the office 3 times a week and make an appointment and pay your copay. One time, this is great for anyone in the family using it. So if you are saying no to a lot of the things, and that's what I'm all about. If you're saying no to going out and planting your favorite flowers, or going out and doing activities, or going to see your friends, and it's spring and you want to get out there and you're limited, try the DPL light.
And we give you a couple things that are a little different. We give you a 60-day return policy on this instead of 30. And it is not designed to cure anything. But I can tell you from personal experience, the back injury that I had a few months back, nothing was going to cure that, but I would sit at my desk with the belt, and it made a big, big difference in temporary relief. This is modern science at its best. We don't have a lot of them. Again, over 16,000 QVC customers are using it on a regular basis. The equipment has a 3-year manufacturer's warranty, and it is FDA cleared. It is a medical device. The 1,500 that we had left in our inventory, people have been on the phone line, so that has dropped. There is no reorder on this. What we have is all that we can get for a while. It's a bigger head. It actually penetrates the skin in a way that a topical gel can't. What happens if you get makeup on it or it gets a little dirty? How do we clean it? What do we do?
Wipe it off. Just wipe it off. It's very easy. It's a therapy that you're not going to really experience anything but other than soothing, gentle warmth. But what it's doing underneath the skin is that it goes to the target area where you're experiencing pain. Ointments can't do that. Over-the-counter drugs can't do that. Many therapies out there cannot do this because of the strength of the DPL LED lights. It gets to the source of the problem. So it works with your body's own natural healing. So it improves circulation by bringing oxygen, vital nutrients, improves the circulation in that area. It also has the ability to get down to the part where you're experiencing pain. So it gets to that joint. Not many things or therapies out there, let alone medications are out there that can do this. So this is why I use this for over 20, I hate saying this, 25, it's now going to be 25 years with my patients.
I've known you for almost those full 25 years.
Oh, you're one of my first patients here at QVC. This is something that I effectively use even on a daily basis now when I see I'm on a limited time seeing my patients.
Right.
Like I said, my trainer got hurt. And immediately when she called me up, I went there with my little doctor's bag, and I pulled out the DPL light, and I put this on her neck, and I said, you're going to sit here for 14 minutes, and you're going to take this home, and you're going to use this. She called me up that night and said, I can't believe I'm feeling better. I can't believe that I can move my neck. So this is something that can really work.
You got to try it. You've got to try it. And now, and I don't want to make any claims that aren't part of the legal statement, but I got kicked literally on my backside by a cow, and it bruised. It bruised. So as crazy as it was, I'm at home for 14 minutes at a time with this thing on my derriere, and I got to tell you, I was surprised how quickly I felt better, and how quickly
Don't you believe the doctor?
the bruise went away. Yeah, it comes down to this. Try it. You know what pain you've got. You know where it is. If it's an arthritis pain, it's in your joints, in your fingers, the knee, the ankle. If it's a lower back issue, like I suffer from. If it's just everyday aches and sprains, this should be in your arsenal. Like Mom's heating pad was always available to her. This is the new way to help to heal yourself. We've got it for 4 easy pay payments of $23.30. This is the last month that this will be available at that featured price of $139.80. That price will go up at the end of the month if there's any inventory left. Again, I checked our numbers right before you and I came on. We had roughly about 1,500 that were left in the inventory. There's 16,000 of you already using it. Actually, we're now down to about 1,200 units. Try it. You have a 60-day return policy. We want you to feel better. We want you to have that freedom back. It's not fun to live with pain. Thank you.
Good to see you, dear.
I love seeing you. You're the best.
too.
You're wonderful.
Thank you.
We've got more. Jane is standing by with our next guest. I think she's out on the patio.
Actually, I'm sitting by, but you would too if you had the opportunity to sit on the converted bench because it's so incredibly comfortable. This is the converted